This
about.
conference will now be recorded.
Hi, everyone. My name is Dolvett Quince. Today, I'm going to talk to a guest, a special guest of mine. We've just recently been acquainted, uh, an authority, I want to say, in this space of wellness as it pertains to hormone health. All of you guys know that I've been talking immensely about the balance of hormones and sort of the things that we don't pay attention to, but we need to. Without further ado, uh, without going into her credentials, etc., I want to introduce my guest, Dr. Kristy Van Kirk. How are you?
Hi, I am great, and I am so excited to be here because this is really becoming my mission as I get into my mid 40s. I'm 44, and I feel like I am finally realizing how important it is to share with women who are going through these similar life transitions the importance of bioidentical hormones done safely, the health benefits that can come from this. I think after the Women's Health Initiative, which is when I was going to conventional OBGYN residency, is about when that was coming out, we as trained physicians, trained very well in obstetrics and gynecology, we were not trained well in hormones, and it has been a huge disservice to women. So I got to the point where I did traditional conventional OBGYN for 10 years, but I knew my passion was the next step. I knew that I wanted to spend more time learning about a holistic approach. And I just did not have the time when I was in the conventional world in the trenches, running from the OR to the clinic, on call, missing family time with my um, family during the holidays. I just could not dive into what now I realize and spend all of my time diving into the importance of supporting women as they go through the transition from their reproductive years into the next half of their life. And we are going to spend at least half of our lives in perimenopause and menopause. And I feel like so many women for so long just kind of that was all there was. Like you got old and that was it. But now I am really here to challenge and encourage people to say, gosh, the next half of my life, I want to be the best half of my life. I only want it to get better and better.
You bring up so many interesting points for me because, I'm hearing what you're saying about the doctors. Let's first go there before we talk about the patients or the common person who's looking for improvement. The conventional way that OBGYNs are trained doesn't involve hormones. Why do you think that is?
I really think it is because they're so busy focusing on everything else, delivering babies, not getting sued, seeing a patient in 15 minutes. They are, unfortunately, my heart goes out to them. They are not trying to be bad people or deliver poor healthcare, but they're
Information.
just in this system where insurance based is unfortunately set up more as a sick care system than a health care system. And it's really hard to break away from those chains of paying back big bills, big debt to say, hey, I want to open my own clinic and I want to take the time to learn new things that wasn't taught, when I went through residency because medicine is changing so fast, but they just get so stuck in that vicious cycle that they don't have time to spend the time with the patients to really deliver bioindividual care. They don't have time to do the learning to say, okay, I feel like I know what I'm doing when it comes to bioidentical hormones. I have to tell you this story. When I was in the conventional world working in a private practice group, when I had a patient on my schedule that said, discuss hormones, I used to really kind of like, I dreaded that because I just knew that I was not trained during residency to be able to deliver the top quality care when it came to hormones. So overall, I think it's just unfortunately the sick care system. We haven't had time to really kind of progress and say, let's be a healthcare system. Let's do proactive work here.
And I'm sure as a woman, you like you said, you came to a stage and age in life where you said, you know what, my hormones aren't functioning the way I thought. So let me dive more into this betterment of myself. How I need to learn how to feel better, right? Um,
Right.
that being said, though, what do you think is going to take for doctors to take the extra step to not get nervous when a patient says, hey, let's talk hormones? Because at the end of the day, I feel more and more people are becoming conscious about hormone health. It's in my mind as a man in his 50s. I'm saying to myself, wait a second. I know my hormones are out of whack. I feel like my mom and my sister were more aware of their hormones being out of whack way before I was. So, what do you think is going to take for the medical environment to land where you are?
I think it is really going to take the patients being educated, patients wanting to talk about this, and patients coming into their doctor's office really being able to be authentic and be genuine and not feel like they're going to get brushed off and told that, oh, that's just normal. I feel like so many women feel like, gosh, the brain fog, or I feel like I'm going crazy. Like all these vague symptoms have gotten brushed off, just saying, oh, that's normal. Like it's to be expected. And so I really think it's going to take empowered patients who are learning through all of these wonderful channels out there. Your Instagram, you do some incredible education there. So I think it's so cool that patients have just like this endless access to education to be empowered so that when they do go into their doctor's office, they can confidently have that conversation and say, hey, this is what's going on with me. These are my goals. And if you can't help me, please send me to somebody who can. And I think that's where, as a consumer, as a patient, it really is all of our jobs to not settle for subpar answers. And if you are working with a provider who is not spending the time with you, and who has not done the training to really be able to say, okay, I am not in alignment with that provider. And the hormone world is really kind of exploding. I am so excited to be alive at this time. It's a feminine awakening, like even in this astrological world. Like I think it really is representative of what is happening here, and for women to say, hey, for women and humans, all humans, to say, hey, we're not going to settle for that. And if my current doctor that is insurance based is not providing me the care that is satisfactory to me, to be willing to take that step kind of out of the comfort zone, out of the traditional zone, and to say, hey, there are doctors out there who are doing incredible transformative healing and really supporting their patients to live their best lives.
If there is questions that a patient should ask, what are some of those questions that they should refer to their doctor and say, look, these are the symptoms. Can you describe some of the things to some of the listeners that they should be asking for?
Yes, that is a great question. So, when it comes to symptoms, we know the traditional symptoms of hot flashes, night sweats, decreased sexual health, skin dryness, vaginal dryness, as far as women. But it's some of those unusual symptoms that now we're really starting to understand are linked to hormones.
For
So,
example,
estrogen is a huge anti-inflammatory hormone. So achy joints, brain fog, thinking, gosh, inflammation in the brain, gut health changes. Our microbiome is very much affected by hormones. And so our microbiome gets less healthy, our neurotransmitters get less healthy, um, depression, anxiety, trouble sleeping. And we know all of these are foundations to being your healthiest. Weight gain, holding weight around the middle. Now, that's a real thing that women,
Around the middle,
especially,
around the midriff.
yes,
And that goes for both men and women, correct?
yes, yes. And the crazy thing about holding this weight around the middle is that is our most unhealthy fat, where we store all of these inflammatory hormones, cytokines, that increase our risk of chronic medical diseases like type 2 diabetes, cardiovascular disease, Alzheimer's. When I talk about estrogen benefits, I really talk to my patients about brain health is probably number one. We want to prevent Alzheimer's and dementia, of course, heart health, of course, bone health, of course, healthy skin, healthy hair, healthy sexual function. Um, but there is so much related to hormone imbalances that start for either men or women. Chronic health issues really coming from that. And so, if we're going to live longer lives, because the world we live in nowadays does keep us a long life, or not necessarily healthier, this is where I feel like the movement is really starting to say, hey, if I'm going to be alive longer, I want to have quality of life and I want to live my healthiest life. I want to have more life in those years of being alive longer. So I really think questions for patients to ask would be, will you test my hormones? And there are so many different ways to test hormones. That can be its own can of worms. And there are experts that believe serum works just great, blood draws. Some say urine hormone tests.
All
Some
right,
will say
serum. Serum works. What's serum?
serum, SERUM, blood draws.
Oh, okay, specific. So it's a blood draw. You said serum and
Yep,
blood draws. If you're saying blood
yep,
draws, I
equals
would say
serum.
number one. Yes, that's number one, correct?
Uh-huh.
Yeah.
Well, really, I would say whatever expert you go to is going to be trained in how they like to test their hormones and have their reasons of why they like to test their hormones. But blood draws really are very easy. And I do use a lot of blood draws myself. So starting with a blood draw, just say, gosh, where are my hormones and where's my cholesterol? Because that's related to my hormones. Where's my hemoglobin A1C? Where is my fasting insulin? Where are my thyroid hormones? And so, really, it's kind of saying hormones is a broad word, and there are so many hormones that work together in this beautiful hormone symphony to really find a provider who is willing to take a look at that is probably the first step, along with really sharing your symptoms with your provider and being able to say, hey, I think this is related to hormone changes.
Essentially, people are becoming more and more concerned with their feeling or their reaction, their speed, their cognitive function, right? What we're saying is ask the questions that says, look under the hood. Look under my
Yes.
hood. Let me see where the imbalances may be. We're amplifying the conversation about hormones because, for the most part, it's not something people have asked in the past. My background being health and wellness, from a fitness perspective, I've always known working out provided a lot of the clarity, the mobility, the hormone balance that we're speaking to. What are some other things that people can do independent of eating right and working out? We talked roughly about BHRT. Describe to the audience listening what is BHRT and what are the other things that they can do as a supplement to get them feeling good again.
Hmm. BHRT, bioidentical hormone replacement therapy. For women, we're classically thinking estrogen, progesterone, testosterone, and they all have their own little functions, but they all work together very importantly. For men, we're talking, of course, testosterone is their main hormone, but also watching their estrogen because testosterone aromatizes into estrogen and we don't want it too high or too low for men. And I have recently even been learning from experts about progesterone, even in men, to help with restful sleep and to potentially balance out estrogen. So thinking those three hormones, and those can be replaced, given to the body, Peloton being one of the leading pellet companies, testosterone and estrogen. We still prescribe progesterone orally, but that would be step one. I would say step two is making sure that a person is draining hormones. And so the analogy of maybe our body is a bathtub, and over all of our lifetime, our bathtub may kind of start to gunk up that drain, and we may fill with things that are not healthy for us, chemicals. We talk so much about hormone mimickers now and exogenous hormones or chemicals, even parasites, bacteria, smoldering bacteria infections. There's so much that can affect how the hormones work once
Yeah.
they're in your body. So if you're going to put the hormones in your body, it's so important to say, okay, if I'm going to put them in, I want to get the best results for them. So thinking about draining that bathtub on a regular basis so that a person isn't overflowing with chemicals that may block those hormone receptors so that you don't even get the benefit of the testosterone or estrogen that may go in the body, to say, okay, I really want to clean those receptors off. So there are excellent nutraceutical companies out there that really have wonderful protocols to say, okay, let's drain the body, but really gets down to liver detox, liver being one of our
I was going to
main.
mention that liver detox,
Yes,
I think, is key. I also believe in the colonics because
yes,
oftentimes your system, you're taking a, we'll call it a toxic system for lack of a better description, and you're trying to put things on top of that toxicity. And when I say toxic syndrome, think of the many, many, many years you've been eating a certain way, be it fast food, meats, etc. And their hormones or that hormone is now within your system. It could take months to years before you can flush out of your system because we keep cycling 365 days of the same quote unquote habits with no mobility, no outlet, if you will. So doing things like a liver cleanse, doing something like a colonic prior to even doing your BHRT, would you advise most people that that is the route to go because then the absorption rate is much higher, much more of a quality?
I think that's a great way to look at it. I feel like sometimes when people come in and they're feeling so crummy, they're super excited to get going and they're like, I just want to do it
Just want
all.
to,
So
I want to feel better.
right, right. So at the bare minimum, it really is kind of like if you are adding the hormones in, make sure you're adding in these supplements to be draining, because what goes in must come out and hormones get metabolized. And this is where some of the deeper testing really can say what pathways does a person metabolize their hormones down. And if they're holding on to more of the unhealthy or toxic, if you will, metabolites, like you want to really support their drainage system.
Currently speaking with Dr. Kristy Van Kirk. For those of you who are just tuning in, we're talking all things hormone health as well as BHRT, a bioidentical hormone therapy. Um, Dr. Van Kirk, I'm curious. I hear you say things, and most people here heard you say things like women should do testosterone, progesterone for even men, and balance. That's kind of scary to hear. What do you mean testosterone? Am I going to get bigger? Is how people respond. Explain to them in simple terms why is it needed and not to be so afraid as they may think.
Oh, thank you for that wonderful question. Because I feel like so many people, probably in this age category, are thinking back to the Women's Health Initiative and thinking cancer or something scary. And so, what I would say is research has come so far over the past 20 years. And when we are talking about putting hormones back into the body, I think understanding that coming from the direction of optimization, we are not looking to make it super physiologic to turn a woman into Arnold Schwarzenegger bodybuilder. We are looking to do it in a very physiologic way that is very healthy for the person and is going to give them so many health benefits. So I think just understanding that there is so much new research coming out. Key is we're not using the synthetic hormones, the hormone mimickers, the chemicals, if you will, that were studied, say, in the Women's Health Initiative that said, oh, hormones are bad. We are using bioidentical hormones, which are hormones that look exactly like the hormones that our body makes. So those hormones can fit into those hormone receptors and give us the exact response that our body's natural hormones would give instead of the hormone mimickers that cause all kinds of bad problems. So I think just knowing that we're now approaching this in a totally different way where we have the data to say decreased risk of all these chronic health diseases that are taking over our country for sure, and even over the world, that we have very safe, very effective, affordable treatments that a person can start on and it can be optimized to fit them in their bio individual lifestyle and that it could be continued for many years to come. I must admit right now I've started putting myself on hormones, of course, because I'm all about longevity. I want to be in my best health. And I'm at the stage of life where if I wasn't using tools, it would be much harder. So these are tools that let me continue to keep my top health results that used to come much easier decades before.
It sounds like to me the information is there. Obviously, what
Yes.
Dr. Van Kirk is telling you guys is simply get the blood work, and every individual is an individual bespoke case. That being said, your blood work is going to tell you where your deficiencies are. When you do go get the work that you might need, or sorry, the hormone assistance that you might need to get back to feeling like yourself again, companies like Peloton will assist you in your testosterone balance. Um, Thank you so much, Dr. Van Kirk, for taking time out to talk to our audience and educating them on hormone health and BHRT. We appreciate you.
Thank you so much for your time. And I love that there are role models like you out in the world, really supporting people to know that there is more out there and the best is yet to come. So please keep up your great work and thank you for having me.
Thank you so much. Have a wonderful day.
You too.
I'm just going to do a